Hello. So I'm here today with my lovely patient, Christina. Um, so what we're gonna work with her today is she is complaining of right shoulder pain. We've also assessed that she has limited shoulder flexion and also some limitation on her internal and external shoulder rotation. Okay, so one technique that we could use for this patient is I could do some shoulder joint mobilization to help with her pain. So what I would first do is I would first start off by asking my patient to please come close. Come closer. I don't bite. Thank you. Okay, perfect. So first, I would go ahead and do some shoulder distraction. I'm gonna go ahead and do that by having a pulling out force towards her proximal humerus, and I'll be pushing in towards the distal end of her humerus. So what that'll look like, I'm gonna go like kind of up in your armpits here. So first, actually, I would, of course, explain my patient what I'm going to do and what to expect. So Christine, I'm going to go ahead and distract your shoulder. You might feel a little bit of movement in your shoulder. It should feel good. If you feel any pain, please let me know and I'll go ahead and stop, okay? Okay, so I'm just going to go just one little pull out. Do you feel okay?
Good, yeah.
Okay, so once we have the shoulder distracted, I'm going to go to her greater tubercle of her humerus. Tubercle, right? Yeah, greater tubercle. And then I'm going to go ahead and do an AP glide. And how we do that is I'm going to first lock my my arm and just go down at a posterior motion. And this is a grade 1 that I'm doing just to help with pain. It's very tiny movements, and I'm squatting with it. And then I'm going to keep doing this until I feel a little bit of tissue change. Are you feeling okay?
Mm-hmm.
Okay. So once I feel some loosening up, I'm going to go ahead and ask my patient to go ahead and do shoulder flexion. And Christina, could you go ahead and raise your arm up? Okay. Does that feel okay?
Mm-hmm.
Do you feel pain?
No.
No? And then say she does still have a little bit of restriction. I would take her to where she is up to the point, and then I'll go ahead and perform some more anterior gliding so that we can loosen that constriction up. That way she could go ahead and go further up with her shoulder flexion.